removed. Is there anything to get rid of a facial age spot about 2 centimetres in diameter?
So, a facial age spot, I believe you mean a pigmented spot? A pigmented thing? I guess so. What would be called a liver spot? This kind of thing, maybe?
I hate that word.
I do as well. It's not nice.
Pigmentation.
Yeah, but a facial age spot. Okay. First of all, get it checked out. If it hasn't changed and it's been there for donkey's years and you know, okay. But if there's any suspicion of any pigmented lesion, it should be checked for skin cancer. That's the really important thing we need to rule out. Sometimes you can tell just by looking at it that's not what it is. And sometimes we want to do more. We'd want to do a biopsy, or for instance. If it's not, it then depends on what it is. So if it is just a flat pigmented area, and you get these flat pale pigmented areas, and some of those are amenable to treatment with topical creams, hydroquinones, those kind of things. And I would say meet the lovely Jenna or Maxine,
and Maxine,
who can advise and introduce you to the wonderful world of topical lightening agents, things like this. The other thing we have is our light therapies that may be useful for that. If it is a certain kind of thing, so there's one in particular I'm thinking of which isn't quite the same, called a seborrheic keratosis. These often get called age spots as well. They're a bit more raised, they're a bit more waxy feeling, they're often itchy. Those can sometimes be treated by actually shaving them off. They can sometimes be treated with freeze therapy as well. So again, it just depends on what it is. There's all sorts of modalities available. So yeah, it can be treated. We can find a way, but we need to make a diagnosis first, and we need to make sure it's not something bad.
Yes, it has been checked out, just dark pigmentation.
Yeah, okay.
So yeah, there are...
most likely topical agent, but hey, send us a photo.
Send us a photo. We can get Jenna and Maxine to give you some advice on where to go with that.
Yeah, lovely.
We actually also have a plasma pen, and
you can
plasma pen. You can. Jenna has done some of her own as well. You can just spray with the plasma pen.
There's a spray technique with the plasma pen. The plasma pen is
colouring it in,
do they know
and you
what
can
the plasma
actually
pen is?
just wipe it off.
The plasma pen is this kind of little handheld device that gives you this little spark of lightning at the tip, and it causes focal little burns, and we usually apply it in little dots for skin tightening. It's great for eyelids, it's great for all sorts of things. I sometimes use it at the end, so you can show Bex. You're brave.
I do like to get my... No, the one a little bit down the line.
Okay, not the immediate one. But there's also a spray technique where you can just zzz over an area, and that can be used for more superficial skin issues. So
for skin tightening around the eyes, there's my... just looks bright red because it's not focusing. Why is it not focusing? Can you see that?
Good. Yes, I try and focus for you.
Hang on. So dots around, and it tightens up the eyelids. Look at my much tighter eyelids. Less overhang on there.
There you go.
So yeah.
Okay.
But that can use, instead of dots, you do it in a spray, like a colouring, and it literally just wipes off the top. I'd say, again, Jenna and Maxine would be better to advise you about this, but this might not be the time of year to do it because of sun exposure and things. You do run the risk of it coming back dark. Yeah,
this is a difficult time of year for treating them.
Once
SPF, of course. Please include SPF in your, because they do respond.